Yes, it's time to turn to this year's keynote speaker. And I believe that he is really the man to embody what this industry is about. So Emmanuel Ligner, please join me on our virtual stage. Thank you for coming.
Hello, Helena. Thank you for having me tonight.
You lead a company which I understood is it's over 8,000 employees, which I would say is a quite big company. But I've been told that you have the heart of an entrepreneur. Is that true?
Yes, of course. I think inside of any company, you need to be an entrepreneur. It's about having passion. It's about looking really far away from the future, find the next trends, and really embrace it, and communicate that passion and that spirit to your entire team. So I think size doesn't matter.
So true, and I'm completely with you on that. I'm curious to learn a bit more about you and your background. So can you tell us a little bit about yourself? For instance, do you like your job?
Yes, I do love my job. I think I am the most lucky man in the world. I have the best job in the world, really. But so as a background, I spent about 10 years of my life in the pharmaceutical industry in various roles, including diagnostic. And I joined the life science industry about 15 years ago, and counting. So the interesting bit is I have a perspective of our customers, a perspective of really the development and the commercialization of drugs, and as well what we're doing in Saitila in particular, which is to support that development and manufacturing of biomolecules. I travel a lot. I lived in various places. I spent 10 years of my life in Japan, where I met my wife. I spent some time in the US, and I'm actually French by nationality, but I spend most of my time, actually more than half of my life outside of France, in either UK, US, or Japan. So very international mindset and experience.
Indeed. So I know your company, you have a legacy going back to 1733, is that right?
That's correct. Wattmann was created in 1733. Yes, and it's part of our business. Yes, indeed.
Yeah. So let's focus on just the past year and the events that we saw at Saitila then, because you actually led the transition towards Saitila. And I'm curious to know what it means for you to have changed ownership. You are now owned by Danaher. So how has that impacted on the overall business, this transition of yours?
Yeah, this is a very interesting event that happened during 2020. You know, Saitila, as you said, is a company which has a very long legacy, a very long heritage. You spoke about 1733, which is when Wattmann was created. But we can speak also about Pharmacia. We can speak also about Amersham. We can speak about many of the small companies that gather together around Saitila today. And of course, Amersham Bioscience was acquired by GE Healthcare in 2004. So we had to really think carefully and plan extremely carefully how to carve out these biopharma businesses from GE Healthcare and to create Saitila. We had two imperatives and two goals only. One, no harm to our associate, to our employee, and no harm to our customers, no harm to our business. What we do really matters. The product that we are manufacturing are very important for the industry, and we could not have any delay, any impact in what is really the asset of this company. It's its talent, it's our employee, it's our people, and that was something that we really wanted to protect. And I think we went through long hours and long months of preparation, and the planning was done extremely well. And so on April 1st, we became Saitila.
That's very interesting. And you mentioned Pharmacia along the way. and I can see your beautiful logo behind you. Actually, I'm born and raised in Uppsala, so I understand how much this logo means for the Uppsala community, but also for Sweden and the Nordics at large. So could you please tell us a little bit about the historical background of this logo?
Yes. It's a logo that I also love personally. Okay, and it was created in 1967 by a very famous industrial designer, Armin Hoffman, and it has been used by Pharmacia, as you remember, not only in Uppsala but really around the world. For their product between 67 and 98 until the merge with Amersham. But we have actually kept that logo on many of our products. And so here's the story. Here's a story about this logo. On February the 25th of 2019, we announced that we will be selling the biopharma business to Danaher Corporation. On the next day, I jumped in a plane and went onto a world tour to meet and have town hall with as many associates as possible. And I arrived in Umeå, one of our manufacturing sites, important manufacturing site in the north of Sweden. And I had a breakout session just before the town hall into a meeting room. And on the door of that meeting room, we had the drop. The logo of Pharmacia was still there, still used. And I hold it, push the door, and I thought, okay, well, I need to bring that back to life because it means a lot for the associate, but also a lot for the industry. So with our head of marketing, Conor McNally, we went and tested this to the customers, and the feedback was absolutely phenomenal. And very interestingly, a lot of senior executive in many in our customers just give us a feedback that remind them really, really good times at the bench when they were students, either in university or right at the first jobs in an R&D lab. And so it's really the symbol of our heritage, where we're coming from, and our Nordic and Swedish roots associated with a new name.
Yeah, I feel you. I was one of those students. So really wonderful to hear about that. I'm also happy to hear and know that you are quite active broadly across the Nordics, not just in Uppsala, Umeå, or Sweden. So you know also that the theme of this year's Nordic Life Science Days is bridging gaps. So of course, this is something we wish to highlight how important it is for the Nordics to come together as one life science region, to be unified in that. And from your Saitila perspective and all these experiences that you bring in from the rest of the world, what would you say are the biggest assets in working and investing in the Nordics?
So here's what I love about the Nordic and having almost or roughly a third of our 8,000 employees that you were talking about in the Nordic and in Sweden in particular. There is a great sense of responsibility in Nordic. There is very good scientists and exceptional scientists, I would say. There is also really great international mind. So this is phenomenal. And what I like in particular around our plant and around our R&D, we have our largest R&D center actually in Uppsala, Sweden, is the quality. You know, there is extremely commitment to do the right things, for the customers, for the science, and there's a great collaboration, I think, which is very important. So I love your theme about bridging the gap, because you know, in this industry, you cannot do anything alone. You have to collaborate. Our history of chromatography started in collaboration between Uppsala University and Pharmacia. And that's where we started with Cefadex, which was launched in 1959, almost 60 plus years ago, and which is still commercially available, still made in the same processes with the same level of quality, and used I think, in something like 50 different molecule processes today. So the continuity, the seriousness, the quality, and the innovation, because there's more and more innovation going on in a collaborative manner, I think is very important. We've done that with the Swedish government when we created the Testa Center, and I think that you have Lotta Lundqvist in your panel that can give you a bit more detail about this, but that was really, really a good example of how the industry, the government can collaborate to make sure that we accelerate innovation. And I think it's part of bridging the gap, the gap between ideas which may come from a university and becoming a product, a commercial product. How do you make this happen? Well, I think the Testa Center is a place where you can come, you can accelerate, you can use a facility that, as a small startup, as a small biotech, you may not be able to afford. But you can come here, rent 5-6 weeks, and then move on to either a CDMO, or actually, because you progress very, very well, invest in your own facility. So all that collaboration and that technology and innovation, I think, is fantastic in the Nordic.
So you're saying that collaboration is actually a Nordic USP. It's something that we should continue to build as a strength.
Oh, definitely. The collaboration between the private, public asset and is absolutely essential, and there's much more to do. And collaboration probably as well between very large pharmaceutical company, and there is some really, really good example, AstraZeneca, of course, but also Novo Nordisk and other, and then much smaller biotech. So, you know, us, which are enabler, which are here to help to accelerate and advance therapeutics, very large pharma, university, and the government. I think there is an ecosystem that we really need to make sure we use, but also we keep alive.
Yeah, indeed. So you mentioned ecosystem, and I think that's very, very important. And I'm quite passionate myself about the connection between, or the need to have an interaction between bigger companies and small companies, and the creativity that is released when you bring those together. So from your experience at Saitila, how does Saitila interact with smaller companies?
So it's a question of value proposition that you can bring to small customers. We talk about Testa Centers. We have another area called Fast Track, which is more services that we can bring in on how to help a small biotech company, which have a very interesting process, to make that process more robust, to make that process more economical, and to go faster, basically. So it's about collaboration, it's about engaging, it's about listening, most importantly. I think this is something that we are very keen on in our commercial team, in particular, about collaboration, about intimacy. And there's no small or big customers. You know, one day Genentech was very, very small. One day Amgen were very, very small. And you know, some of our colleagues knew and were in contact with the Amgen folks when there was only 4 of them founder in a very, very small rented lab. And so this is where, if you are engaging and if you are very close early with the science, you can collaborate and help the development of those small biotech to be very, very successful, having in mind only one thing. And this is why I'm coming to work every day. This is why, you know, if we go back to the personal touch, this is why I love my job, is we think about the patients. We think about the millions of patients that we are helping every day. And I think the pandemic right now is bringing this every day. You cannot open the news or read a newspaper or open your iPad without seeing how important biologics are and how biologics are saving the world. And to be part of that saving the world, to be part about making a child better because it has a genetic modified, a heritage disease that cannot be solved today or treated today, but there is a hope because you have a new gene therapy, for example. This is unbelievable. This is a sense of purpose that is just phenomenal.
Yeah, it's about people at the end of the day.
Indeed.
And you mentioned yourself the pandemic. So touching upon that just very briefly, how has this year, in that sense, affected Saitila from a biopharmaceutical point of view? I know you have been quite active. Can you tell us a little bit about that?
Sure. So the pandemic was first and foremost about keeping our employee and our associates safe. We have a plant in China, so very early on last year, we were facing making sure that we keep our associates safe, and we learned a lot about what we needed to do and how to do it in China. And then when the pandemic moved to the West, we were already kind of ready. So because what we do really matters, we could not shut down any of our factory. So we have to be very agile on keeping our associates safe, but also how to suddenly make sure that our product still goes to the customers from a logistics standpoint when the whole airplane flying. All right. So we had to really engage in a very close collaboration among ourselves, with our partners, and making sure that we continue to do business. So security of supply, continuity of doing business was very important. As the demand really exploded, just to put things in perspective, usually during a normal year, there's about 2 billion doses of vaccine which are manufacturing. Today, the industry is on a mission to manufacturing 16, 17 billion doses. And that is an unprecedented effort that is needed. So we needed to react, to hire, to invest. We've hired more than 2,000 people over the last 10 months of the life of Saitila, the first 10 months of the life of Saitila, and we are continuing to invest, and we will continue to invest. So it's about really pragmatism. It's about working differently. It's about being into a 2D environment more often than in a 3D environment, and it's about, again, bringing the sense of purpose, making sure that everybody, every single associate understands that what we do really matters. Yeah.
Well, I can definitely sense your sense of purpose, and I'm gonna release you very soon. But finally, I would like to ask you what do you, from Saitila's perspective, expect to get out of being active here at Nordic Life Science Days, the partnering, the program? What are your expectations from this event?
As I said earlier, nobody can do it alone, and it's about collaboration. So just come and talk to us, engage, ask us questions, and make sure you reach out. I think this is the most important thing. We want to be part of this incredible community of the life science and the biology community in the Nordics. So come and reach out.
Perfect. So to everyone who is listening, you heard the man, reach out. Thank you so much, Emmanuel. Merci beaucoup. Thank you for having you. And I look forward to connect the Saitila team in partnering very soon.
Have a good day.